Good day. So here are 25 must-know facts about the topic pancreas and gallbladder. So for the gallbladder, it's a pear-shaped sac. This is where it is. It's under the liver on the right side of the abdomen. It has three parts: the fundus, the body, and the neck. And this is the cystic duct, right upper quadrant. So here are the ducts that are related to the gallbladder. We have the cystic duct, the common hepatic duct, and then the common bile duct, all lined by columnar epithelium and mucus secreting cells. So for the third fact we need to know is that the function of the gallbladder is to transport bile from the liver, then it goes to the gallbladder, and then it goes to the duodenum. This is really important. The gallbladder does not have a submucosa. So which is the gallbladder, which is the pancreas? So you can tell because it has folds. So this is the gallbladder there in its mucosa. So the fifth fact we have to know is that the gallbladder is mostly serous or serosa, not adventitia. So the sixth fact, how can you tell it's the gallbladder? So we talked about this. So because of its diagnostic features, we have the mucosa that's folded, as we've seen in the previous slide. We have the epithelium, the diverticula, the muscularis serosa, and again, it's absent submucosa. It does not have a submucosa. So we have a disease associated with the gallbladder. We have gallstones or cholelithiasis or biliary calculi. So this is usually fused crystals of cholesterol. Cholesterol stones is the most common form. So the so it can be divided into two: acute cholecystitis due to gallstones and chronic cholecystitis. So again, this is the inflammation of gallbladder with mononuclear inflammatory infiltrate in the gallbladder and wall. So how can you tell? Because there is a presence of lymphocytes in the muscularis or possibly even in the lamina propria. So now let's proceed to the pancreas. So is it a retroperitoneal organ? Yes. So it's located behind the stomach. So it has three parts, just like the gallbladder. So it has the head, the body, and the tail. So next slide, please. So here is the flow of pancreatic secretion. So we have the centroacinar cells, intercalated ducts, intralobular ducts, interlobular ducts, main pancreatic ducts, and then finally it then goes to the common bile duct. So please remember this flow of pancreatic secretions in relation to the organ, the pancreas. So it can be divided into two. We have the exocrine and endocrine pancreas. So for the exocrine pancreas, it's mostly serous compound tubule-alveolar gland. Serous alveoli similar with the parotid gland and comprise most of the pancreas. So the exocrine pancreas comprises most of the pancreas. Next. So for the endocrine pancreas, what I want you to remember is when we think of the endocrine pancreas, we think of the pancreatic islets, so which are composed of several cells, which we'll talk about later on. So what are the cell types in the pancreas? We have BAD, SIGE, PP. So B cells centrally located, it produces insulin. A cells, they secrete glucagon. D cells, they produce somatostatin, which inhibits the release of hormone. C cells are clear cells, unknown function, we don't know what it does. G cells are, it helps secretes gastrin, it secretes gastrin, which stimulates gastric hydrochloric acid secretion. And we also have the PP cells for they help produce pancreatic polypeptides, which inhibit the release of exogenous pancreatic secretions, all irregular polygonal cells with central spherical nuclei. So again, what releases gastrin? The G cells. What releases insulin? The B cells. How about for glucagon? The A cells. Okay, next slide. So the three disorders related to the pancreas, we have type 1 diabetes mellitus, type 2 diabetes mellitus, and pancreatic cancer. So for type 1, it's also known as insulin-dependent diabetes. It happens usually before people, to the affected individuals before 20 years old. Juvenile onset diabetes mellitus, and it's characterized by polyphagia, polydipsia, and polyuria. And for type 2, it's also called non-insulin dependent and happens older than 40 years old. And lastly, we have pancreatic cancer, mostly adenocarcinoma affecting head of pancreas. So what part of the pancreas? The head of the pancreas, and usually head of the organ near the duodenum. Thank you.